we are just at the 5 o'clock. I'm sorry, I'm over in Central Time. We are at the 4 o'clock hour Mountain Standard Time. My name is Jessica Seawright, and you are here at the Utah Criminal Justice Center's virtual skills series on the risk, need, and responsivity model. I'm so glad to see folks logging on. I do want to give folks just a few minutes to wrap up their last meeting and jump on this Zoom. So we'll just start a few minutes right after 4. We are recording and we'll get started soon. I'm going to change the slide here so that folks can start to add their name. You know, you can add the program you're coming from or the affiliation you feel comfortable adding and your email address. What the email address is going to do is to make sure that I get you the CEU quiz to receive CEUs for this event. The way that this one is set up is a series of 3 events: risk, need, responsivity, and they will be across the final months of this year, the same Thursday, same time, same link. So the goal is that we offer these both live, like you all are a part of right now, as well as if you can't make all 3 sessions, you can catch the recorded session the following Monday on UCJC's YouTube. And between coming live or watching the recording, at the very end of the series, you'll complete that CEU quiz and receive that certificate shortly thereafter. So you can see my email. If you provide in the chat, I'll make sure to get you the CEU quiz link, or you can just shoot me an email if you have any questions anytime along the way. Oh, hi, Chad. Thanks for being here. I'm just going to continue forward with the housekeeping items as folks continue to log on today. So I'll just remind you to add your name to the chat, and I'll remind everyone at the end of the event today. This event runs for an hour, but I'll continue to stay on this Zoom call in case you had any questions. We do offer a regular consultation hour or a strategy share, the goal being that you can ask us any questions you have. You can start to sort of look into projects that you'd like to partner on or collaborate on. We have funding through the division, the Department of Substance Abuse and Mental Health, to provide technical assistance to providers across the state. So if you see a need, if we can help you with anything, stay on after this event and we can talk about it. So you're here, the risk, need, responsivity model for working with justice involved clients. This is really geared to start to help folks understand what RNR means, where it comes from, sort of bridging that criminology and social work or other mental health professionals, case management, sort of bridging our fields together, taking the research behind both. Hi, Mario, nice to see you, and John, and bridging the gap and helping each other share research from our different fields. My name's Jessica Seawright. Christian Sarver will be joining us later, and she'll also be doing the second session, which is next month on criminogenic need. So I'll let her give you more of an introduction about herself next time, but I'm a senior research analyst with the Utah Criminal Justice Center. I've completed 2 rounds of program evaluations across the state of Utah with our public treatment providers using the correctional program checklist, and also worked on a variety of projects at the Utah Criminal Justice Center for the past 8 years. But I came to UCJC from the College of Social Work. I'm a CFW, and so my hope is that tonight I can bring the lens. We have folks on our team that have a criminology background, and if you have any follow-up questions, you're really interested in some of the research that we come across tonight, then follow up with me by email and I'll get you in touch with that information or my colleagues. I'm coming from a social work background, and my goal really is to respect and recognize that you all in your different capacities are likely holding a lot of research, a lot of literature, and attending to many needs that you meet in your offices each day with different clients. So the goal really is to find where RNR meets that and to start to understand what some of the legislation and rules are through the Justice Reinvestment Initiative, and to make that feel like it's fitting in the work that you do with your justice involved clients. So if anybody has, they came to this meeting with some initial questions, go ahead and put those in the chat. We're going to rely on the chat a little bit more just because I'll be talking more than I have in other events that we've offered. So that probably will work a little bit better than sort of coming in on mics. So throw any questions in the chat. If you haven't been on a Zoom call before, the chat is just in your toolbar of options. So, all right, that's me. If you feel like sharing a little bit about where you're coming from, what risk assessments you've used, or any specific questions, like I said, just share it in the chat. Here's our homepage of our website. This is where you can sort of look at current projects and reports if you're interested more about who UCJC is, what we're doing. The reason that I'm here tonight is we have a partnership, a collaboration with DSAMA, or the Division of Substance Abuse and Mental Health, and really hoping to support community treatment providers in working with justice involved clients. So I mentioned the CPC. We do program evaluations statewide, and it's using this tool that comes out of the University of Cincinnati. Ed Latessa is a common name you might be familiar with. And so you can see publications are coming out of his and Lowenkamp's work. And it's just sort of interesting because this program evaluation uses RNR to look at different programs and see how well they're meeting what we know works with justice involved clients, both in institutional settings and in community settings. So we will be focusing on recidivism. And I'm sure in your different professions, your different work, you have different risks that you're looking at with your clients. Tonight, we're really honing in and focusing on recidivism, and we'll sort of look at how that compares to relapse a little bit later on. But recidivism, we are looking at, it's measured as criminal acts that resulted in rearrest, reconviction, or return to prison with or without a new sentence for a 3-year period following the prisoner's release. That's coming from NIJ, the National Institute of Justice. So you can already see how specific that is, and that really is to cultivate an ability to study that, the 3-year period. If you've already sort of looked into this field, you'll see across different studies that recidivism might be looked at from a different lens. Outcomes might be completely different than recidivism. Your goals in your own profession might not only be recidivism, but if you're here, my hope is that that's on your radar and that you're sort of looking at how to prevent future criminal behavior in your justice involved clients. That's what we're going to be focusing on. We're here at session 1. And this series is intended for treatment providers. I've sort of said this, who work with justice involved clients. And we're going to provide an overview of these concepts, the RNR concepts, for targeting clients' risk of recidivism. And here's sort of what we'll be looking at tonight. We're going to think about probability of risk of recidivism. We're going to give a brief history and some resources to learn about the RNR model and the different generations of risk assessments. And we're going to just talk and maybe discuss the difference between risk of recidivism and risk of relapse. And then the second half of the event, we're going to share a few case studies just to illustrate those concepts. Those case studies came from the Utah Department of Corrections. They shared a few case studies to help us in these training events. All right. So what is criminogenic risk? It's the likelihood that someone will continue to engage in criminal behavior. Research is showing us that risk is best predicted by a validated instrument, and we're going to come back to that, called a risk assessment. And when compared to professional judgment alone, a validated risk assessment are 20 to 30% better at predicting future criminal behavior. So The important thing to think about with criminogenic risk is that not every system-involved person poses the same risk to the community. So what is risk? It's important to know that risk is not danger, and risk is not seriousness. Risk is not blameworthiness. Risk is chance. It's probability. And so keep in mind that high risk does not mean that these clients are 100% likely to recidivate. This is coming from a presentation, a training that our director at UCJC has given. Her name is Dr. Emily Salisbury, and she created the Women's Risk Need Assessment. We have a separate site if you wanted to look into some of the literature about that. So there's a lot of misconceptions about, what risk instruments can do. The likelihood that a client will recidivate, it's actually around 50 to 60% likely based on the instrument you're using. It just means that someone who's high risk has a higher probability that they'll recidivate than someone who is determined to be moderate or low. So just take a brief moment and think about other ways you hear about risk or probability. We have a risk that it might rain or snow, or risk of heart disease. But in a different context, you can kind of see that it's suggesting that it might occur. So similarly, risk of recidivism is not saying that it will for sure happen with a high risk, that is assessed client, but that it's more likely to occur. So if we look at a low risk situation, a client who scores as low risk, it doesn't mean that they're never going to recidivate or commit a new crime. Some folks who assess as low risk will recidivate, but their probability is far lower than those who are assessed at medium and high risk. So these labels of high, medium, and low can sometimes throw folks off. Does anyone have any questions with that start? All right. So kind of referring to a study by Lowenkamp and Latessa, who I just mentioned, they found that low-risk individuals who were placed in residential treatment programs, so these are more intensive, where they're taken and they're in a residential setting, they recidivated at a higher rate than the comparison group of other low-risk clients who were not placed into a residential treatment program. And the high-risk clients who were placed in the residential treatment program recidivated at a lower rate than the high-risk clients in the comparison group. So that more intense treatment, when used with the high-risk clients, was more effective. So let's talk about this idea about a low-risk person and why placing them in too much treatment or too much intervention might be a bad idea. So think of a 20-year-old college student who has been arrested for underage drinking at a party, and they're court-ordered to attend a 6-month residential treatment program. So if we assume that there are no other risk factors present for that person, then why might that have a negative result? So just to add, think of what's coming to mind. We don't want to put this low risk or this client who's assessed at low risk with the high risk clients, because that person could learn high risk behaviors. And with those clients who are assessed at low risk, we also don't want to interfere with the things that are making them low risk, such as employment, education, pro-social connections. So this is where in the state rule, where you hear that as a treatment provider, you must separate high from low risk. That's where that's coming from the research, is that research has shown it does have negative effects to treat a client who is assessed at low risk of recidivism with too much intensity. So risk of reoffending is not the same as the severity of the offense. So an individual who has committed murder may be at low risk for reoffending, despite that's the seriousness of their crime. And similarly, an individual who's committed multiple misdemeanors but no serious crimes, you may have crossed paths with this if you work in substance use disorder treatment. They may have a higher likelihood of reoffending. So that's where that subtlety is in risk of reoffending versus offense severity. All of this is sort of drawing out why it's so hard for just a clinician to determine with accuracy each time and with reliability and without bias what a risk level is. So in Utah, the most commonly used risk assessment instruments that we've come across on our team are coming from the level of service inventory, the LSI, which has several versions. The Utah Department of Corrections, including the Adult Probation and Parole, APMP, uses the level of service case management inventory, or the LSCMI. And the division has substance abuse and mental health has opened up licenses and accessibility to the LSI screening version, or the LSIR screening version, which looks at the same factors as the LSCMI. So I'm wondering, has anyone come across the LS suite of instruments? Does that sound familiar? If you feel like putting in any other risk instruments that you've come across in your profession, in your field, you can put them in the chat at any time. The RANT is one that comes up a lot. Risk assessment, risk and needs triage is the RANT. We'll talk about that a little bit later. All right. I'm hoping y'all can hear me all right and that the video and everything's looking good. If anything's bothering you on your side, just go ahead and you can direct message me and let me know. So let's talk, let me just go ahead and progress the slide. Let's talk about the research behind risk assessment. So there's been multiple generations. This is the research behind risk assessment has been evolving and developing for quite a number of years. So first generation I've referred to a little bit is professional judgment. And the risk of that is that even when they looked at professionals who were coming from forensic psychology, medical doctors, using their professional judgment to assess, whether folks should be released on parole, different circumstances, that was not a reliable way to assess their risk of committing new crimes. So what happened is we started to see the earliest and most commonly used instruments are the salient factor score, which came from the US Parole Commission in the 1970s. So that's when the second generation of these scales and assessment tools started to emerge. Other institutions were using the classification systems by the National Institute of Corrections, NIC, to classify. These instruments were using static risk factors such as criminal history because these factors do not change over time. So the issue with this second generation, or the actuarial risk scales, is that they don't give insight into the recommendations for programming and treatment to target dynamic risk factors, things that you can change. So the reason why these are, that's an important point for this audience, because you all want to target for change. You want to support these folks in making positive change and changing their life around. So that's where we move into where folks recognize that and they started to introduce needs assessments. Needs assessments were developed as a supplement to those risk scales. I know this is really exciting at the end of your work days. If you have any questions, go ahead and throw it in the chat. The third generation is risk needs assessments. And the first of those being the LSI, which I just mentioned, the level of service inventory that started to be developed and released in the 1980s. In contrast to the needs assessments that were coming out, the risk needs assessments included only those needs that were also risk factors. And this helped to start to focus the attention on criminogenic needs, which is the topic of our second session. The fourth generation, which is the most current, is that linking of assessment with case management. So really putting to work risk assessments to work for you all, to work for clients, to acknowledge strengths and responsivity factors that will impede or promote the benefits of treatment. So I just sort of dropped the third R of our series, responsivity. That's going to be discussed more in depth on our third session, which is in December. But responsivity, again, are factors that impede or create barriers to the benefits of treatment. So keeping folks from completing treatment that's targeted at criminogenic needs. So let's talk a little bit about validity and reliability, because that's where the first generation professional judgment started to be questioned. Is it reliable? Is it standardized? And is it valid? Can we be certain that this works with each client the same way? Can we be sure that all of our employees, all of our staff can perform this in the same way so that bias is not a part of our decision making? So reliability refers to the consistency of the instrument. If two people were to use the LSI to assess the same person, the results should be similar. And validity refers to the accuracy of the instrument in predicting the outcome, like recidivism. And you see different versions of risk assessments for different populations. So you'll see institution and community versions. And while some of their outcomes may overlap, there might be subtle differences in what they're studying. Just like when we looked at that recidivism definition, there's slightly different ways that they're looking at these risk assessments to perform and tell us about what will happen when that person either leaves the institution or finishes their community treatment. And it's important to look at one big takeaway from this session is it's so important to look at validation studies for any instrument that you use, any instrument that your team uses. So we'll cover that a little bit more on the next slide. So talking about the impact, we really just have to think, I don't know if anyone on this call is in an institutional setting or if you all are in the community, but depending on your setting, you know, I know that the classification will have different consequences. And there's, you know, at its best, classification is going to support you in decision making. Where does this person need intervention and programming? Who needs to be separated from who at that time? It's going to help reduce bias in making those decisions. It's going to help improve the placement of clients in addition to your substance use assessments. It's going to help you utilize resources more effectively. You know, earlier we talked about high risk and low risk receiving different benefits from intervention. So if you have limited resources, which many of us do, you have to select where your monies go, where your resources go, where your clinicians go. And so risk assessments can help you put the, you know, create that impact. And one of the goals of intervention with justice involved clients is to enhance public safety. There's this duality in treating clients who are justice involved. They are your client and their mandate into your care you have a role that you're playing with enhancing public safety. Does anyone want to stop there and talk about that sort of tension? I know it's kind of tough on these calls to jump in on the chat, but just want to make sure I'm not missing anything here. Okay, so returning to validity and reliability. You know, I'll send multiple resources multiple texts that are just great resources for learning about this field in the email with the CEU quiz. But Dr. Salisbury and her colleague, Patricia Van Voorhees, Dr. Patricia Van Voorhees, talk about there's an ethical, it's really a part of the ethics of how we are interacting and treating individuals who are involved with the justice system. We have to ensure we're using validated tools. And the reason that is because if it's not validated to your population, so say you are in, you know, at San Juan Counseling Center, if your tool isn't validated for your clientele, it could be reading wrong. It could be assessing your clients incorrectly and maybe treating them with too much intensity or too little intensity. So that's really where you want to calibrate and validate the assessment tool you select. there's different ways that you can go about this. I just see that Dr. Sarver's joined the call, Dr. Christian Sarver, and she'll join in here as she wants to add to what I'm saying. But really important to validate your tools, risk assessment tools, because it will help make sure that the tool is working accurately for your community. And I just wanted to note that you can either rely on tools that have been validated widely with many studies, or we've made a recommendation, for example, with the risk and needs triage instrument, to have more validation studies completed in our communities if it's a tool that Utah courts and community providers want to use as a risk assessment tool. So welcome, Christian.
Hi, everyone. Sorry, I was coming from Taylorsville and caught in traffic because apparently the traffic at this time of day is bad between Taylorsville and Salt Lake.
Risk of traffic. Do traffic folks ever make predictions?
Sorry, who? Do what?
I just wonder, I was talking about, risk of weather. Do traffic folks, I wonder, ever make risk predictions?
I have no idea.
A question.
I was meeting with highway safety. Those would have been the people to ask.
Those would have been. So, okay, we're going to get back to it. So why is criminogenic risk important? So the risk level tells you how much treatment an individual needs in order to reduce the likelihood that they're going to engage in that ongoing criminal behavior. And the risk level also tells you which clients can be combined in treatment groups. So, as we're doing program evaluations, we see this sort of conundrum. There, for example, you have a DBT group. A dialectical behavior therapy offers many benefits to many clientele, or at least, that's what providers are telling us. And so they'd really like to share this DBT group intervention with multiple clients. And in some settings, rural settings, it's really hard to offer that group very often. So what we often recommend is that if you're using risk assessments, we know that we want to separate low and high risk. And in some cases, there'll even be folks that aren't justice involved. So that makes it even more important that the group is, if you're mixing with non-criminogenic, non-mandated clients, you really want to make sure it's only low risk in there, and that you're reassessing and seeing who needs to be in that group. So initially, public safety was widely perceived to be the most important purpose of correctional classification. That's kind of coming from Van Voorhees and Salisbury as well. And you can hear, we're seeing how risk classification has really important purpose for correctional rehabilitation and community treatment and rehabilitation. Intensive treatment programs are more successful with justice-involved adults who are high and medium risk than it is with those justice-involved adults who are low risk. So tying into ASAM, which some of you, if you are substance use providers, may also be using at the same intake assessment, similar to the way that ASAM is informing you for the dosage that client will need in terms of substance abuse treatment. The risk assessment will inform the dosage in terms of the treatment that targets the risk of recidivism. Higher risk clients should be receiving more treatment than the lower risk clients, which means more hours in treatment, more treatment targets, more time practicing these new skills so that they're successful when they've completed. And providing intensive treatment to lower risk clients, it can actually increase their risk level, like we've talked about already, by interrupting those pro-social relationships and activities that they already have available to them. That is their strengths. Similarly, combining these low and high risk clients in treatment, it can increase the risk of recidivism for those low risk clients. We talked about the college student who was sentenced to an intense treatment for their DUI or their offense. So I hope that comes across clear. So big takeaway, assessment is the engine that, I'll come to you in just a second, Mario, I see that. Assessment is the engine that drives effective programming for justice-involved clients. Mario, do you wanna jump on the microphone?
I was just gonna ask a question. So today I watched a training video And it said that, yeah, of course, that lower risk, clients cannot be mixed with high risk, but it also said that moderate risk clients can be mixed with lower risk and or high risk. Is that a thing, or was the video misleading?
So Christian, correct me if I'm wrong, but what we tend to recommend is that, if you're making those choices, consider the intensity of treatment that your clients at the moderate and high risk level are receiving, and just either leave low risk alone, consider individual tracks of treatment, or keep them separated from moderate and high risk.
Yeah, and Mario, I don't know what the video was, but generally the research that I've seen suggests that, so for low risk clients, it's not necessarily that you would provide no treatment to them, it's that you wouldn't combine them with moderate and high people who are moderate and high risk of recidivism, and you wouldn't target recidivism, right? So you might still be targeting substance abuse or mental health or other things, but I think the difficulty with the risk level is it's really talking about risk of criminal behavior.
Right, yeah, and that's my question, because the video was saying that the moderate, risk can be combined with higher risk and or lower risk, but lower risk cannot be combined with high risk. So it's the middle one that I'm kind of having a hard time understanding, because from what I'm getting here, and maybe I'm just misunderstanding, what I'm getting here is lower risk, we shouldn't be combining them with higher risk. But the video that I watched this morning said that moderate risk can be combined with lower risk and or higher risk.
Interesting.
High risk.
Yeah, so I've never seen any research supporting that. Everything I've seen says you want to pull low risk out and not mix them with moderates. Who put the video together? Do you know?
I'll send Jessica the link to the video.
That would be great. Yeah,
Yeah.
I might be misunderstanding kind of the research they're talking about, but
Okay.
everything that what I've seen is that you want to be, I think you are getting at an important point though, is are we doing moderate risk people a favor by combining them with high risk people? I'm not sure, but the research tends to put those two groups together. So
I hope that like the next month's session on need, at this session, we're talking about risk, and it's low risk, moderate risk, high risk. Next session, we're going to be talking about criminogenic needs. So Mario, I'll look at the link that you send me. We'll make sure we're not taking it out of context. And then we might sort of consider, what is that moderate risk client's needs? What are they demonstrating as high, moderate, and low in those needs as we pull it apart and start to look at where they need intervention, need programming, and we might start to see a path through. So hopefully either the case studies at the end of this session or next session, we can start to pull that apart. Thanks for that question. So, as a sort of a summary to bring us, we're about halfway through our session. A validated risk assessment tells you who to target, moderate and high risk, how much treatment, higher risk clients need more treatment, what to target, criminogenic needs, which I mentioned we'll cover next time, how to treat, cognitive behavioral interventions are recommended, and additional services and supports. And that's really starting to hint at responsivity, which will be the December 3rd session, final session of this series. And when treatment is complete, when risk assessments will help us determine when folks have met, when treatment and programming are effectively reducing that person's risk, and the probability of them committing a new crime is lower. So remember that risk is malleable, and a primary purpose of that treatment is to reduce the risk of recidivism. And similar to ASAM, risk assessment results, including reassessment of risk assessment, just like you're doing with the ASAM, should be integrated into the treatment plan. This is going to allow treatment providers to effectively target the risk of recidivism throughout the treatment course. Another way is similar to the use of the ASAM to determine clients' progress in treatment and their dosage needs related to substance use. Their risk levels should be reassessed through the course of treatment to help that clinician and the team make decisions about treatment progress, changes in dosage, treatment completion. So for example, a client's risk level would be expected to reduce throughout treatment participation, throughout that intervention. Once the risk is assessed as low, formerly high risk clients or clients assessed at high risk can be put in treatment groups with low risk clients. And it's important that this decision and all the decisions related to treatment progress be based on the results of your validated risk assessment. Okay, so we're just going to switch gears and test your knowledge. This is sort of a primer for our second session. So take a look at these bulleted items, read through them, and just think about which items you believe indicate that a client is at high risk of recidivism. And recall that this refers to a client who is likely to continue engaging in criminal behavior. I'll give you all 10 more seconds if that's all right. So let's see, how did you do? What were some of the maybe I should still allow you to see it. Which were some that you felt determined risk of recidivism? Does anyone want to share any?
Homelessness?
So maybe homelessness, that's on the table. Does that make you, homelessness, are you thinking about, you know, if they don't have a home to return to, they'll likely not be successful in their treatment targets?
Yeah, that's what I was thinking.
Jessica, there's substance abuse in the chat room as well.
Oh, thank you. Thank you, John. John says substance abuse. Okay, so from research, we know that substance abuse is considered one of those dynamic criminogenic needs. Homelessness, Mario, is going to come into play when we're looking at responsivity. So the barriers, the things that are going to make treatment, including substance abuse treatment, really hard for folks to successfully complete and make those changes. So that's where responsivity kind of comes into play.
And Jessica, can I touch on one thing there? I think what the RNR model doesn't really account for, right? It's sort of talking about once you have people post-sentencing, how should you make treatment decisions around them? It isn't addressing, so in terms of like someone who is actively kind of engaging in offending behavior, those would be high risk. I think, Mario, your point about homelessness does bring up that people who are living in public are likely to get picked up by the system, right? They're going to be seen by the system and incarcerated more. From this model, that they're not really committing criminal behaviors, they're just getting picked up because, does that make sense? So they're not, that's not really an antisocial behavior, that's more a function of living in public. And this is not a model that does a good job of taking that on. So
yeah, because what I was thinking is that I often hear, you know, well, you know, winter's coming and it's cold out there, so I might as well go somewhere where it's going to be warm and I'm going to have 3 meals a day. That's what I was thinking.
Yeah, and I think those sorts of things are people kind of engaging in survival skills, right? To kind of, but not necessarily engaging in, it's just that we live in a world where the criminal justice system is one of the places that have to take you in certain circumstances. And I think this model is really saying that likely if you assessed those people on a risk assessment, they would pop up as high need maybe, but low risk of recidivism.
So an important takeaway from these sessions is not that it's not that you shouldn't engage resolving issues related to detox, homelessness, mental illness. Those are important. Those are high priorities, especially when you're coming from a treatment provider, community treatment provider setting. What we're looking at with the RNR model is that when we really hone in on this risk of recidivism, targeting criminogenic needs, it will help you reduce that client's risk of ongoing criminal behavior. And I think, Christian, you made a good point about differentiating criminal interaction with criminal behaviors. So, all right, so I have substance abuse highlighted there because, you know, for this audience, for who these events are made for, substance abuse is a high priority. Just wanted to remind you all that people who are at high risk of recidivism have multiple criminogenic needs. And if someone has a high need only in the area of substance abuse and not in the other criminogenic needs, they are not going to be high risk of recidivism. So conversely, an individual who has multiple criminogenic needs will not be less likely to continue criminal activity if substance abuse is the only need that's treated while they're in your treatment program. So it's a very important criminogenic need, not to diminish that, but treatment for substance use disorder is not on its own capable of reducing that high risk person's risk of recidivism. And that's because we anticipate that they have multiple criminogenic needs happening. So if you look at this list, those are all of the, these are the risk factors, and we'll get into the dynamic risk factors or criminogenic needs, those that we can support clients in making change in next month. Okay, I just want to take a pause. If anybody has any questions or something's feeling a little unclear, go ahead and share that in the chat or jump on the mic. Christian or I can discuss that with y'all. And then we'll move into a few case study examples for the second part of this event. Okay, well, I hope in that first half, you sort of had a couple takeaways about what risk means, what recidivism is, where risk assessments came from, how they've sort of developed, and how they will continue to develop. I think an important thing to consider is that, you know, we saw 1, 2, 3, 4 phases so far since the 1970s. And, you know, the director of the Utah Criminal Justice Center is actively working on progressing the field of risk needs assessment to make rubber meets the road, make it a really effective tool to help folks all along the pathway. So, okay, pathway is probably not the best way to phrase that, but case studies. So just wanted to express my gratitude to the Utah Department of Corrections and some of their staff for providing these case study examples so that I could share them with you and so they could feel more real, like the folks that you're actually crossing paths with. We've revised them lightly for training purposes. And of course, we're not using any real clients' names or personal health information. So this is a lot of text. If anyone is interested in having this sent to you by PDF, I'm happy to do so, or I'll just give you a few moments to read through that case study. Also, you've heard my voice quite a bit, but if anyone would prefer it to be read out loud instead of needing to read it, I'm happy to do that as well. You just have to let me know in the chat.
Jessica, can you see the chat? There's
Okay.
Send the PDF.
Awesome. Okay, thank you, Jeff. I'll get to work on that. Just get the right email address. Give me one more moment. That's on its way. Please let me know if you don't receive it. You all want a little more time to read and digest this case study, or would you like to start talking about it? Thanks, Jeff. Right, so we'll be looking at this case study from a risk lens. We will we'll come back to this case study next time for the need session so that we can get into some of the details about those specific needs. Anyone have any comments, initial thoughts about what Jake's risk level might be? We have a criminal history that began at age 16. We have some things occurring early on in his life. We're reading a little detail about what his family of origin was like with his mother, father, who he was raised by, which is his aunt. And this report is coming from his probation agent. So what feels important in this case study? Sorry, go ahead, Christian.
So I think one thing that is interesting about these examples, and that in teaching, so I teach the forensic domain in the College of Social Work, the practice classes, is kind of the struggle with operationalizing those criminogenic needs. So for example, when I say an antisocial cognition, I mean, honestly, what is an antisocial cognition? Like, what does that mean? I think, and in my classes, if you ask 10 people that, you get 10 different ideas. And I think this one does a good example of showing when we say antisocial cognition, that's not like psychopathy or kind of antisocial personality disorder. That's more sort of justifying the behavior by saying it wasn't my fault, right? So that's one example of kind of like, I don't have to follow the rules. These things weren't my fault. People are out to get me. I mean, I think this model is important because it really is focused on the idea that these things can change. You're not saying that this person is pathological. You're saying they've coped with struggles in their life in a way that is not fundamentally kind of pro-social in its orientation and sort of justifies antisocial behaviors, and that that's something you would target and change. The other one that I think is really interesting is this idea of leisure and free time. I mean, it sort of intuitively makes sense, right? That I mean, I think pandemic me, right, who couldn't go out and do anything, my free time activities became far more focused on television and glasses of wine. But again, that you really want to think about like how someone's time is structured in ways that sort of point them away from engaging in antisocial behaviors, right? Either because they're spending time doing something they like that is pro-social, or because they're spending time with people who would express some kind of social disapproval if they suggested, hey, let's go steal some beer from the gas station down the street, or kind of whatever that is. So again, I think this is an example again of a need that maybe seems a little bit like, as a therapist, should I be targeting someone's recreational activity, but thinking about how the lack of recreational activities ties to engaging in antisocial behaviors, essentially.
I think earlier John mentioned substance abuse, and so many of you might be here sort of tracking through this case study, looking at the history of substance abuse, a girlfriend who's you know, coming from circumstances where they were in prison and also using drugs. And so, but when you come down to the bottom two lines of this case study, Jake has not used meth or other substances for 1 year since completing the treatment program in prison. And Jake states that they don't feel addicted and really uses when other people are using. So giving you a little bit more information that's not on the screen, his probation agent reports that Jake has scored, high risk to reoffend in criminal history, family marital domain, leisure, recreation domain, companions, and pro-criminal attitudes. So I'm that will give you a comparison to how you were reading it. And he scored moderate risk in education and employment, in antisocial patterns, and low in substance abuse. So I'm going to progress the part. Let's see. We can start the next case study. We've got a few more minutes. I'll start to wrap up around 55, just to make sure I share all the details you all need for CEUs. So the next case study is sort of a two-parter. We're looking at Lisa. Again, this one has a lot of text, so please let me know. I did send Jeff this PDF. I'm happy to send it to anyone else who wants it. Carrie, let me make sure I have your email address here in the chat. Okay, Carrie, I see that, and I'm going to send it right over. Carrie, I'm hoping those reach your email inbox shortly. So as our time kind of draws to a close, we will come back to this Lisa case study. It is full, and I think it's a really good illustration and something Christian can work with when you all are discussing criminogenic needs. I do want to tell you that her risk assessment showed as high risk to reoffend at this interval, part 1, substance use, companions, pro-criminal attitudes, and employment were the highest need areas in her life. So hopefully her showing as high risk in substance use is really going to correspond to the ASAM or the specific substance use assessment that you're using for Lisa, and it's going to connect there. And then the risk assessment, the risk needs assessment, is really going to show you how big of a role the companions, pro-criminal attitudes, and employment are also a factor in Lisa's life, and those need to be attended to before she finishes treatment. Next time, there's a Lisa part 2 where you get to kind of see her progression and her reduction in criminogenic risk. I think it's a really good example. Okay, great, Carrie. So those of you who did receive the PDF, just read them through. You'll come back to them if you join us next time or if you watch the session on YouTube. And for those of you that shared your email in the chat, I will be sure to share the case studies and the PowerPoint slides with anyone that shared their email address with me, as well as the CEU quiz. Now, remember, I told you this is a 3-part series. So the hope is that you have access to join these live sessions, or you can watch the YouTube recordings, or any combination of those. And then after the December session, you'll submit for the 3 CEUs. If you need other CEUs, we reopened the CEUs that we've offered through 2020 and 2021. So there's a lot of sessions available. It was in the email that went out this morning, and I'm more than happy to share more details with you. Those are available until December 31st. So if you or anyone on the team needs CEUs, please take us up on those free CEUs to learn more about working with justice-involved clients. Does anyone have any more questions or business to attend to before I sort of end our formal session? Well, I really appreciate you being here. We're going to send an evaluation your way. Please let us know if we helped you understand criminogenic risk any better after this session. Again, we can support you for ongoing technical assistance. As you are logging off from this session, you can choose to stay on for the consultation hour, strategy share, or join us any month. November and December, we'll also be offering the consultation hour after this session. So if there's a specific question you have going on at your specific program or place of employment and you want to talk it through, stay on tonight or stay on in the future. Thanks so much for joining us for this first session in the RNR series.